Welcome everybody to our topic today, which is home oral care during Safer at Home. My name is Peng. I'm a pediatric dentist, and today we're going to talk to you about this great topic, which hopefully you'll be able to describe the development of some common oral disease, be able to illustrate how to actually prevent disease through oral hygiene practice at home, and then be able to identify different dental treatments for these common disease. So I'd like my support team to help me deploy. First question, I wanted to actually ask you a very, very simple question, which is if you have a cavity in your mouth, you may be able to pass it on to your family member in the house. Please select. There's no right or wrong, so please feel free to select any option. Okay, we'll give it another 10 seconds and then we'll actually stop the survey. So please, this is your last chance, answer now. All right, thank you so much for your quick answer. And if I could have my support team, please pull the result for us. So most of the people, more than 80% of you say it's false, meaning that if you have a cavity, you won't pass it on to your family. There were 2 people said it is true. Okay, so thank you so much. Let's stop sharing the result. If you are actually on your screen on the top left corner, it may have a button say close. You may close that survey right now. So you can actually see the presentation. You can get out of the polling screen. Okay, so this is a tricky question. And the answer actually is true. You actually will be able to pass it on. You say, how is that gonna happen? Well, this is why we're gonna actually talk about dental cavity is actually the most common oral disease in humankind. It's the most common infectious disease. And it's actually also known as tooth decay or a cavity. It's the most common chronic disease in children and young adults. It's 4 times more common than asthma. Most of the people will hear someone that you know that will have asthma. And 9 out of 10 adults actually have cavity in somewhere, whether it's on their tooth or so-called their root surface of their tooth. Now, a lot of people will notice cavity when they start feeling sensitive, when they're eating or drinking, or they actually notice there's a hole on the tooth, like you can see on the picture. However, there is something actually very, very important. It is actually preventable. So if it can be passed on to other people, this is something that we should actually be very concerned about if we actually have a cavity. However, we're going to teach you how to prevent it. I want to talk about another thing, which is called periodontal disease. This is a very, very long name. What it really trying to tell you is this is also known as gum disease. A lot of people probably heard about something more sophisticated called gingivitis. As you can see in this picture that's showing here, this young person actually have very puffed up gums and a lot of yellowish, whitish, blackish thing around the tooth. This is due to the fact that there is infection actually in the gum, and it is showing how severe it actually can be infected. Now, most of the time we will see in adult population, not saying that kids won't have it, they may not have it as severe as adults. And almost half of the adults over 30 years old have experienced some form of periodontal disease. And the prevalence will increase with age. 70% of the adults over 65 years old actually suffer from it. And it is more commonly seen in men, somehow gender discriminate. And then it also has specific populations such as people with certain medical conditions like diabetic or people who smoke tend to be more prone to have this condition. It is also preventable, notice. So if you actually are having this condition, notice that this can be prevented, and we're going to teach you how to do that. Now, going back to the science, Okay, when we talk about all these diseases, we wanted to talk about how we actually get them. We're going to talk to you about something called biofilm. And this is something that actually naturally occurred. If you go to the beach and on the rock, sometimes you feel like it's a little slippery. That's biofilm. So it naturally occurred, and they also occur in your mouth, unfortunately. What happened is when your tooth, after a brush, there's a lot of protein in the saliva. It will start staying on the tooth surface. Bacteria found it very attractive. It's more sticky than the other surfaces, so it's like to stay there. And then it will actually start attracting a lot more. It will grow itself, and it will start having a house, like the second picture. And then you will start having friends come over and then start having parties, like the third picture. And then eventually they wander off, and then it will go to other surface. So just because you have cavity in one area, that doesn't mean it does not pass it on to other area. And this basically shows you why it happened. Now, these bacteria in these biofilm, it's also called plaque, which is when it actually gets more and it changes color from very clear, you almost not notice it, to somewhat yellowish, similar to your tooth color. So that's why a lot of people can't brush it off. They actually don't know where they're hiding. And it actually will want to get fed. So whatever you eat, whether it's candy or soda, any sugar, it will be eaten by the bacteria as well. And then it starts changing it to acid, which is a byproduct after the bacteria digest it. The acid will like to stay on the tooth surface, and then it will actually start digging into the tooth slowly, eventually it creates a hole, which is called tooth cavity. Now, in a more sophisticated way to talk about it is acid actually remove the mineral inside the tooth. So we call it demineralization. If the cavity gets bigger, like the picture showing, it starts traveling to the middle of your tooth, then it attacks something called the nerve and the blood vessel inside your tooth, and it will actually generate infection, and it's causing gumbo on your tooth, on your gum, which is called tooth abscess. Now, we actually have something called saliva, which is a huge help for us to defend these bacteria, bad bacteria, okay? Saliva, it's water. So watery flow will flush off all the food debris on the tooth surface. It also carries minerals. So it will actually go back to the tooth and then put the minerals back on the tooth, and it will also neutralize the acid that's created by bacteria. However, some people, they suffer from loss of the saliva, and they're called dry mouth. These people, they are more easy to get cavity for sure, you can imagine, without all these buffering capacity from the saliva. And also, they are much harder to eat and talk. So there's ways to actually take care of it. You can actually ask the dentist, and there's many different ways we can actually help these people. Now, when the saliva or your biofilm started getting a lot of bacteria growing, and they mix it up with your saliva, which has a lot of great minerals, but they're mixing with your biofilm, the bad bacteria, and it will actually start accumulating, get harder and harder, and stay on your tooth. And this is what we call the hard tartar, also known as calculus. And it's impossible to actually remove with any toothbrush. We will have to actually use a tool to help you get rid of it so that it will stop all the infection around your gum. Gum disease is also known to be associated with systemic health issues. So as you can see in this picture, the bacteria in your gum is not just gonna stay in your gum. It follows everything to travel to your whole body, and then causing other issues such as your heart issue, your liver issue. So the best solution would be to start with good oral hygiene. Now, how do we perform that? First, you are gonna have to brush twice a day minimally with fluoridated toothpaste. And then you're gonna clean between your teeth with either a floss or some kind of floss adapter or replacement. And then definitely eat healthy and limit the amount of snacking. And then lastly is to make sure that you visit your dentist regularly and get your teeth cleaned. So I'm going to introduce my colleague, Dr. Brian Kuhl, to continue the presentation and teach you how to practice oral hygiene at home and prevent these diseases.
Perfect. Thank you very much, Dr. Peng. Really, I personally was really surprised that cavity is an infectious disease as well. So amazing information that I'm sure a lot of us didn't realize as well. Next up, we have Dr. Kuo. Dr. Kuo is one of our dentists as well at the Alhambra Clinic. Dr. Kuo is very knowledgeable in this area as well. Personally, like Dr. Peng, I've had the pleasure to talk to Dr. Kuo in between his appointments sometimes. But definitely, I think everybody will continue to learn a lot from these next following presentation as well. Dr. Kuo, please take it away.
Hi, how are you guys doing? All right, let's, just a little background information about myself, but let's move on to the next slide. There we go. Okay, so we're gonna talk about oral hygiene tools. And there's 4 main topics I'd like to talk about, which is the toothbrush, toothpaste, floss, and mouth rinse. And let's start this off with a survey question number 2. We'll give you about a minute, and there's no wrong answer. Just kind of just pick whatever you want. All right. Give you guys a few more seconds. Looks like the responses are still coming in. All right, let's go ahead and close up the poll and see what it shows. All right, so it looks like, you know, the manual toothbrush, naturally that is probably the most common item. It's cheap, it's straight to the point. Looks like this floss is pretty good. It's pretty high up there. I'm glad a lot of you are using toothpaste. It's pretty standard, that's great. All right, let's move on. Next slide, please. All right, so let's begin with the toothbrush, okay? And that was like the most selected item on the survey. All right, so let's talk about the brushing method. And the Bass toothbrushing method is probably the most common and straightforward, simple one. It's very safe. What it turns out is the bristles are pointed at a 45-degree against the gum line. So some people actually don't point at the gum line, they just point at the tooth. What they're promoting here is pointing at the gum line because that's where a lot of the gunk or plaque is built up. It's important that you move the bristles along gently. You're not there trying to saw against your teeth, aggressively. And just go along between 2 to 3 teeth at a time is very common. So some people go really fast and they just go 5, 6, 7 teeth, they're just going back and forth really hard. You do 2 to 3, there's more focus and more attention. All right, next. All right, so now we're going to talk a little bit about the electronic or the power toothbrush versus the manual brush. They're both good. I want you to keep that in mind. It's not that if you use one, the other's no good suddenly. The pros of the electronic power brush is about 30,000 brush strokes a minute versus the manual, which is about 500 a minute. There's a timer built in, so you brush longer and do a better job. Some of the more modern ones have a Bluetooth technology where it kind of hooks up to your phone or tablet. Sometimes it has like fun programs for children where like brushing becomes a game. So you can call it the brushing coach. And then there's also more efficient biofilm removal. So when you spend more time, you will be doing a better job. And then there's, of course, the natural caries reduction in the dry mouth. So that means, you know, with less bacteria, with less problems, you just have less cavities. Some of the main cons would be the cost and also the replacement heads of these power brushes. They cost money too. I mean, so you have to buy them specifically just for that purpose. All right, next. All right. Now we're going to talk about the tongue. That's for some people, they're very good about brushing it. Some people aren't aware they need to maintain that. It's a good habit to brush your tongue. You're not, you know, you don't want to put it so far back that you're uncomfortable or you feel like you're choking. Some people, I know that you see that little white stain or whatever. You know, don't be afraid of that. You just want to keep it clean. Just brush it a few times, may take some time. Some of it's really resilient, so I don't want you to feel like you have to scrape it, your tongue like no other. But just give it a try, be consistent, and it'll naturally work itself to a healthy point. All right, next. All right, and this is, you know, an obvious one, so toothpaste. I'm sure everyone knows what toothpaste is. All right, next. All right, so a big deal about toothpaste is having fluoride in it. You use it about at least twice a day is highly recommended. After breakfast and before bed. I catch a lot of patients doing this once a day. You really got to do twice a day, okay? The once a day thing is kind of cheating. It's not really doing its full purpose. And you want to really apply the fluoride on your teeth for, you know, to get a really good effect. So as shown in the PowerPoint, the active ingredient is the 1,000 to 1,500 ppm fluoride. That's just a dosage amount approximately. And then the main purpose of fluoride is for cavity prevention and teeth strengthening, okay? And this has been scientifically proven, so it does work. All right, next. All right, so there's another form of toothpaste called sensitive toothpaste. It's good. I mean, you can use sensitive toothpaste or the regular toothpaste. They're both, you know, it doesn't mean that one is less effective in cleanliness, but one has more ingredients for sensitivity. I want you to keep that in mind. So if you were to use sensitive toothpaste all the time, it should be safe in the long run. It's for dental hypersensitivity, which happens about 60 to 98% of patients with gum disease. Sensitivity mostly affects canines and premolars. And then there's the sensitive defense ingredient, which is the potassium, which is 40 to 57% in concentration. And of course, the fluoride actually has some sensitivity protective properties. So fluoride is definitely, you know, very good multifunctional. All right, next. All right, there's a type of whitening toothpaste. It's really just for removing surface stains. It does not change the tooth's natural color. So there's a difference there. I want you to think that if I use this, it's not going to be like bright as a white wall, okay? Some contain some other ingredients called a chemical blue coverine. And this takes about 2 to 6 weeks to show the effect. I spoke to, I forgot the name of the company, but that manufactures the whitening toothpaste. But I remember they told me that it's just, they have like more like heavier particles in the toothpaste. So it's like sandpaper, like a more rougher effect. So it's better at removing stains, but it's still safe. All right. And let's move on. All right, and this is dental floss. It's very important. It gets neglected a lot. All right, next. All right, so like I said, it's heavily neglected. A lot of people choose not to floss their teeth, and they don't realize that's actually equally important. You will get food stuck between your teeth, and a brush is just not enough to get it at 100%. It's important to floss properly and show good technique. There's some samples here. There's a lot of toys out there too to help you floss. I mean, we can't go over it all, but you can see, like in the picture, you can see the hands. And it's about pulling the floss against the teeth. You don't want to saw your you don't want to, you're not there to saw your gums. You're not there to like, you know, do it so it's so painful and it bleeds. You know, that's not the purpose of flossing. The flossing is to remove stains, so you're pulling the string against the tooth, okay? So it's side to side, more of a pressure. I want you to remember that. It's very important. You don't just saw it down and just shove it against the gums and start sawing back and forth. It's quite painful, and it could lead to recession, actually. All right, next. All right, so here's the alternatives. These are good, and it's a little bit more specialized. I don't think these are like, not everyone knows about this. You can get some of this at CVS or your supermarket. I mean, it's pretty safe. It's like floss holders, proxy brush flossers. So it's pretty commonplace. We just have to put a little more effort into getting them. All right, next. All right, so this is a big one now. Water irrigation as a floss alternative. There's a lot of promotion for this about its effectiveness. A lot of people feel that they can use this in replacement of floss. Now you gotta be careful here. The water irrigation is very good, it's effective, and there's nothing wrong with using it. But like the hardened calculus, you know, this hardened plaque or the really sticky stuff, I think, or heavy food that's jammed in, like, you know, real tight, you gotta be careful. The water irrigation may not be perfect for that. Like I said, it's very effective. It's very good. I mean, some of the elderly people who have difficulty flossing because of eye-hand coordination reasons that they can't control, then the water irrigation is a very good source. It's good as a debridement tool, but it may not get some of the sticky materials out. But again, it's still very effective. It's not like you shouldn't try it. If you like it, you know, definitely use it. But, you know, don't forget the old-fashioned flossy string. If you can do it, you should still give it a shot. All right. Next. All right, so there's a lot of studies out there about tartar reduction between floss and then the irrigation power floss. They're saying that the patients actually like the power flosser because there's compliance. What compliance means is that they're more willing to use it frequently. And it is very handy to use a power flosser. Simplicity, ease of use is always a strong promotion. When you use the oral irrigation with a power toothbrush, it was found to be statistically better at reducing bleeding and better at reducing gingivitis than manual brushing and flossing. So I guess if you really want to put some money in and try to maximize everything, then you can give it a shot. But if you do a very good technique by hand and you're doing a thorough job, you can still get by with that. Okay. All right. Next. And of course, this is a constant reminder: floss the teeth you want to keep. Brushing is not enough. You need to floss. All right, next. All right, so we're going to the mouth rinse department. By the way, I know you see a lot of brands like Listerine, Colgate, Plaque, whatever's out there. So we don't endorse any specific brand. These are just examples. There's a lot of good brands out there. You have to try to see what you like. All right, next. All right, so a big one is the alcohol-containing mouth rinse. It's powerful. The alcohol is between 11 to 20% ethanol. It is scientifically proven to reduce bacteria and tartar buildup. It will decrease gum disease, okay? It does work. However, there are some people who don't like that feeling of the alcohol in the mouth. There are a few patients have told me stories where they feel like the lining of the oral mucosa have been dried up. So if you have a dry mouth, you may not like this product. And even if you don't have a dry mouth, some people may not like it. They may feel like the mucosa is irritated. So there are alternatives without alcohol, which we'll talk in a bit. And then there's some science about the oral cancer risk of the alcohol. This is a little bit debatable. Other studies have come out trying to fight back against it. But just kind of throwing this out there. All right, next. All right, so fluoride rinse, very popular, very safe. Like we talked about fluoride earlier. Fluoride is a very important component for cavity prevention and strengthening teeth. Can't go around with this product. It doesn't, there's ones with, that don't have alcohol, so it's very gentle on the gums. If you have dry mouth, this is an excellent adjunct to, proper brushing and flossing. And just kits like this. Here's the sugar-free sweetener. And you don't want to drink this, okay? For all the mouthwash, you want to be careful. And you just want to use this for children age 6 and up. And it should be very safe. All right, next. All right, so we're going to bring in a survey question. And we'll give you at least a minute, guys, to just pick true or false. There's no wrong answer. And we'll give you guys a chance to kind of see how you feel about this. We'll give you at least half a minute more. Keep coming in with the responses. You guys are doing a good job. We don't know your answer, by the way. This is anonymous. All right, let's a few more seconds and let's get this closed up. All right, let's see what it shows. And the far majority said it's false. That's a very good response. It's not so simple to just fill and drill. Depending on the size of the cavity, the treatment can change, and you want to keep that in mind, okay? Anyways, prevention is still the best method. All right, let's move on from this. And I'd like to bring Dr. Peng in to continue this webinar. Thank you, Dr. Peng.
Thank you, Dr. Ko. That was a wonderful presentation. All right, so we're going to actually talk to you about the survey question that you just answered. We were asking you about filling. Okay, so what happened if I cannot actually fix my cavity with the filling? What other things can actually do to help me? So some of the common dental treatments you probably have heard of. Obviously, the top choice would be a filling. There's different color of filling, by the way. There's a white one, which is a tooth color one. And also there's a silver or a black one. It turned black after over time. So it used to be silver shiny. That would be on the top left corner of this picture. Now, if the cavity gets really big, it won't be safe to actually put a giant filling like you just saw in the picture on the top left side. Sometimes actually the tooth will break, as you can see. It wasn't very well supported all around. So in that case, then we may have to actually put a helmet for the tooth, which is also called a crown. There's different material of the crown as well. It could be a metal, which is in the middle of the picture, and then also a tooth color one, which is very effective as well. And then if the tooth ended up actually having an infection, like you have an abscess, then obviously you will need to actually have the infection removed inside the tooth, which is actually also called a root canal treatment. And after that, most of the time, people will hear that they will probably have to have some kind of support inside the tooth, whether it's a pose or a build-up, and then you will actually cover the tooth with a cap. All right, so people are asking, is it safe to actually go to a dentist now? We actually are probably one of the safest place on earth because we have been dealing with infection all our career. So we have what we call a standard precaution, which means that we will put on any kind of things to actually prevent disease from transmitting between people, including we will wear masks and then we will put on gloves. And now we're actually implementing something more than that. You will see in this picture, we will wear a whole cover gown and we will wear something cover our face, which is also called a face shield. And sometimes we will even wear something over our hair to actually prevent things accumulating and then going between the patient. we also are doing screening, pre-screening, which is a questionnaire for the patient. And we also ask patients to do something called pre-rinse. This may be some offices are doing it, some are not, but study have shown that the pre-rinse will actually inactivate the bacteria or virus in your mouth. And also some offices like ourselves, we're actually implementing additional equipment such as air filter, UV light, and also additional suction to prevent any aerosol inside the treatment area. And lastly, we obviously frequently cleaning all the public area to prevent any transmission of infection. So yes, we are doing extra on top of what we already been doing to ensure that we're preventing disease from occurring, and also we are protecting everybody, all the patients, all the people that's working in the environment. So some take-home messages, if you don't remember anything, I want you to remember. First, we talk about cavity and gum disease. They are very common, but they are also preventable. And you have heard that good oral hygiene practice, such as what Dr. Cole mentioned, toothbrush, toothpaste, simple as that. But in addition, maybe you know, add into the floss and also mouth rinse, you are going to be in very good shape. And on top of that, eating healthy and come to see your dentist when it's available, it's definitely going to make you very, very, very healthy. So hope you actually enjoy what we have showed to you today. And we are very happy to answer any question you may have. Thank you very much.
Thank you very much, Dr. Peng and Dr. Kuo. I think it's been very informative for all of us. We have a number of different questions in our chat function. I would like to present to our doctors here. The first one is, how often should you actually be replacing your toothbrush? I think it's a very common question. Toothbrush, they have this little indicator at the front top as well that you supposedly change once you get to a certain point. But is that actually accurate, or should you actually be in fact like would be sort of the go-to method?
Thank you, Kevin, for a wonderful question. This is a very, very common question, like you said. And I do believe that most of people have heard the toothbrush need to be replaced in a good period of time. You can't just use one toothbrush for the rest of your life. So unfortunately, that's not gonna happen like that. And manufacturers also have their recommendation, but obviously depending on how you use it and how frequent you use it as well. The most frequent timing is between 2 to 3 months. The best way you could probably tell is if you look at your toothbrush and you look at the head or the little bristle on it. If you start seeing them opening up like a little flower, seem very happy looking at you, then it's probably about time to say bye-bye to them. And if you know, you also notice there's a little junk or toothpaste residue at the base of that toothbrush, that might also tell you another thing as well. So look for little signs and you can probably evaluate the best timing for you to change them. Thank you.
Thank you. And Dr. Peng, on a similar question, you know, a lot of people are always concerned about bacteria growth on the toothbrush. How do they keep it clean? You know, most people after they brush their teeth, they just rinse it, right? Is there anything else that they really need to do about it, or is that generally good enough?
That's a great question, Kevin. So most of the time people will be able to change the toothbrush frequent enough to before actually the bacteria is accumulate enough amount to attack you. Now we have to think, your mouth is not completely no bacteria, it's not sterile. So unfortunately, we do have to somehow live happily with the bacteria. good thing is if you actually keep your toothbrush clean, let it air dry, it's usually a very healthy mechanism to maintain it for the duration. There are certain equipments that I have actually seen on the market. There's little box that has UV light. People have utilized that. And remember, one of the gym that I used to go to have that actually as well. So definitely can consider that. A lot of the power toothbrush also have that comes with it as well. So definitely can consider using. There's also little ultrasonic bath machine that people feel more comfortable getting it clean. It's similar thing to the same machine that people use to clean their denture. So multi-purpose, I suppose. Then lastly, just make sure that, keep it in an air dry location. Don't keep it in the cabinet. It needs to see a little bit sun, a little air. Not saying you have to hang outside, let your neighbors see it, but give it enough airflow to air dry, and then make sure you wash it really nicely clean. Sometimes we're in a hurry, we finish brushing and then we clean it in 2 seconds. That may not actually be the best thing, so make sure that you thoroughly clean it before you dry it. Thank you.
Perfect. I think that answers a lot of people's questions on that. And now we talked a lot about toothbrush, and I guess this is definitely a common one. And I actually wondered about it a long time ago when I first switched over to a power toothbrush. And sometimes you look at some of the power toothbrush, the head is actually a lot smaller than what you buy as a one-time, or I shouldn't say one-time, but certainly a disposable one. So like how does that impact? I know we talked a little bit about how fast it spins and all that. Does that actually compensate for the fact that it's got a smaller surface area? I know there are other versions now that's actually larger. But this question comes from one of our listeners, and I think that's a great question too. What do you think, Dr. Peng?
Awesome question. Honestly, if we look at on the market, there are so many different types of head with power toothbrush. Like you mentioned, there's a circular one, there's a regular shaped one, there's a larger head one, there's one that's spin, rotating, oscillating. There's all different type and shape. But at the end of the day, I think picking the one that's really you feel more comfortable is the most important, because thinking about even regular manual toothbrush, it comes with different size and shape as well. The most important thing I always tell people is actually where you brush it, not how the toothbrushes look like. So the mechanism of putting the toothbrush at the right location, like Dr. Cole was mentioned, angling it in the way or position it along the gum line between the gum and the tooth. That's usually where bacteria likes to hide, as you can see. They don't want you to find them. They won't be staying right here, for you to brush them. No, they obviously wanted to hide. So position it in the right place. Any toothbrush that will be able to reach every single surface of your tooth is much more important. Some people have smaller mouth than normal. So the Asian female in the back here, it's a lot harder to brush. Keeping the large toothbrush there will probably actually end up injuring the gum. So definitely choose one that's a little smaller head. The spinning definitely will increase the efficacy of removing all these biofilm that we just talked about. So definitely consider one. Also, every company may have a little difference in between how fast it spins or how much it vibrates. So try it out, see if you can actually feel comfortable using it. It is an acquired feeling. That's how I can describe it. Not everybody will enjoy how it feels like at first. So try it out, and then you will be able to find one that meets your need.
Perfect. And on the same, or I should say along the same lines, we're talking about brushing between the tooth and the gum. And, I think this particular question really talks a lot more about it, which is when people brush, your gums can bleed. And then, or when you floss, you touch the gum a little bit, and people kind of feel, and I do the same thing, and I'm kind of like, oh, did I go too hard, or is it just something else, or is there another problem? Generally, what does that actually mean? Like when you brush or when you floss, are you irritating it, or is it just a sign that there's a deeper problem?
Very good question. So we first have to differentiate, is it truly an infection or did I injure my gum? So definitely, if you know for sure that you're using the technique properly, then it probably actually is a good thing that you notice that in areas that have maybe potential infection or inflammation, like the picture that I showed at the beginning, remember that puffy gum, that it's pretty dramatic, but even if it's slightly puffy, you probably not notice a difference, but your floss and toothbrush knows. And so when they go around the area, it does create a bleeding. And it's good. I actually tell people, you know what? If it bleeds, that means you're brushing at the right place. So keep it up. So then that way it actually will decrease the amount of bacteria in the area, because now you're decreasing the pocket of the puffiness of the gum. And then it will slowly actually decrease the bleeding. So definitely is a good sign if you notice where you can focus on. And that might also be the area where you can spend more time.
Well, that's very interesting. Yeah, thank you, Dr. Peng. A lot of times when we think about bleeding, the first reaction is, oh, let's stop, right? Just in case. But that's really interesting perspective. I think it's very helpful for us to remember it's not necessarily a bad thing. And now, sort of, when we talk about bleeding and sort of helping get rid of bacteria buildup, etc. We typically use a whole bunch of different types of toothpaste. And on the toothpaste, I know we touched on it a little bit earlier with Dr. Kuo. Whitening toothpaste, we learned a little bit about the ingredients. Does the whitening toothpaste itself, does it pose any sort of health hazard at all, or does it actually reduce the properties of the other ingredients in the toothpaste, or is it just a marketing thing?
Thank you, Kevin. That's a very good question, and we actually get that question a lot because nowadays everybody all want to look like Hollywood stars. Me too. So everybody else thinking, how do I make my appearance look a little bit more appealing than what is already very appealing? Whitening is definitely something that's one of the top asked questions for sure. Every dentist has been asked that question. Whitening toothpaste is definitely a big market right now. As Dr. Kuo mentioned, it is actually, what they do is they put what we call a low abrasive material in there to help you remove the natural staining that you may have, or acquired staining, such as if we drink coffee, tea, we eat certain food, or we smoke. There's many different reasons we get staining. Certain medication actually will stain your teeth as well. So these are actually something that can be removed if you go to a dentist, they polish your teeth. So there is a similar concept. Instead of having a dentist polish your teeth, you polish it at home with your little toothpaste that has a low abrasive to it as well. Like Dr. Kuo mentioned, obviously, first, do not swallow it. Okay, do not swallow any toothpaste. They all taste very good, by the way. But that's probably not the best thing to do. And second is, if you utilize it in the wrong way, then it might be aggressive in certain area. And absolutely, if you already have more thinning tooth, some people actually, their tooth is just thinner than the other people. It might be a little more sensitive actually afterwards. It does not change your natural tooth color, so it just make it whiter because now you kind of take off the jacket, the dirty jacket, and then now it shows the underneath white enamel that you have. But if you are going to use it, just be very careful using it. Don't load it like a huge amount. Use the amount that's recommended, and then brush it in the right way. Don't over brushing it, and that should be safe to use. Thank you.
Great. And on the topic of overbrushing or not over or underbrushing, and it really ties into sort of like the frequency. I know sort of different cultural backgrounds, how they were brought up, especially different types of parents. They're encouraged, and sometimes they build up a habit in terms of when they brush their teeth. And I think Dr. Kuo or yourself actually touched on this topic a little bit earlier as well. is it really too much if they brush, 3 times a day? When I say 3 times, a lot of times people wake up and they feel like, hey, I really need to brush my teeth. And then they'll brush again maybe after the first meal or after lunch, and then they brush obviously before they go to bed. Like how many times is really considered too many? Or is it, generally fine? Because, we talked about how it can potentially, if you brush way too frequently, obviously you're sort of wearing down your teeth a lot quicker than what nature intended it to be. But, certainly I think a lot of people are more concerned about not enough. Which leads to a whole bunch of problems that you discussed earlier. What would be your advice to people? Is it, do we really need to brush, when we wake up in the morning, or is it mostly after when we eat?
Great question, Kevin. Brushing, how many times to brush, how frequent to brush, it is really, really important. And it's actually something that it's a personal choice. We encourage at least twice a day, but if you can do it more than that, we are going to be the happiest person on earth to hear about it. It is very, very interesting that you brought up that some people are more concerned, would it actually brush away my tooth if I brush it too many times? The answer actually is enamel is stronger than you thought. Enamel actually is as strong as your bone. So consider such a strong structure, it would be really hard actually to brush it or to even make a dent on it. You really have to heavily impact it on it. Now, some people actually have areas have tooth structure that's missing. It's actually technically not on their what's so-called the white enamel area. It's actually on their root surface. Now that's a whole different story that we're gonna talk about. So to answer your question, if in the morning you wake up, you feel like you need to brush it, by all means brush it. I'll be very happy to hear that. Definitely after every meal, if you could, that probably is the best time to brush it, because remember we talk about fat with food. So if you eat, that means they eat too. And if you brush it off, that means they're gonna starve to death. So your goal is to somehow find a way to prevent them from growing bigger family and accumulating other friends together, meaning that you give them less food, then they're not gonna like you, they will run away. So that's the whole point of brushing it after you eat. And the other times, I'll be very happy to hear that as well. Thank you.
Yeah, always follow the dentist's advice, right? Because otherwise, when you go to the dentist's office, you may not end up walking away as happy, or at least during it, maybe not be happy, but everybody walks away happy, right? So, we talked about mouthwash as well. As one of the areas that we can really help prevent, cavities or help, bacterial grow, build up. I remember, a number of years back, there was a debate as to the alcohol content in the mouthwash. There were scientific studies that were done. A lot of the larger producers start marketing products that had zero alcohol. And it's less intense. Supposedly it has the same effect. Is there a real distinguishment between having that alcohol content or not having that? If you were to choose, one type of mouthwash, which one would you recommend, Dr. Peng? You look down the shelf, there's all kinds of different colors, all kinds of different brands. Many comes with many different features. So when I read it myself as well, like in terms of what the debate was with alcohol, without alcohol content, I thought, that was good information. But is it really what they say, like without and with? It's the same effect, but to me, it almost feels like if it really was the same, why would you market both? So maybe there is a difference. So would you be able to sort of help us identify which one would you recommend to use? Or what type, I should say.
Definitely, Kevin. Thank you very much. It is actually a great debate. Back in the days when people started to notice what alcohol can do to mouth. So alcohol actually was introduced because study found out that alcohol actually will go into these bacteria and then make them explode. And then that way they won't be able to be effective on you because they died, obviously. But after we started to realize what alcohol can actually do to our mouth, especially it's actually causing dryness of what we call the lining inside the mouth. And some study have shown there may be a relationship between early changes of these mucosa, what we call the lining inside the mouth, and the early sign of cancer. And so that's when they started to realize, hey, aside from alcohol, is there some other thing can we actually use? And so they did a lot of research and found out that there's other ingredients aside from alcohol that can do the same effect, but without the side effect of alcohol. And that's why the non-alcohol mouth rinse actually started to come into surface. A lot of people still enjoy having the alcohol because it gives you that the freshness feel of it. But like I said, without that, you can still get the same benefit. So if you really cannot use the alcohol one,
well, I just want to say thank you very much for everybody's listening. I hope today's presentation is helpful for you. If anything, remember, these conditions can be prevented by doing good brushing and good flossing at home. So keep up the good work. And we hope to see you at the dentist with beautiful smile, okay? Thank you so much.